this discussion because depression, shame, stigma, and substance abuse are just a few of the challenges experienced, yet left mostly undiagnosed in LGBTQ identified communities of color. In My Mind is the name of a national health conference being co-hosted by a coalition of organizations that will delve into conversation and workshops about the need for mental health services for those communities.
Joining us now are two experts who can help shed more light. First, we welcome one of the conference organizers, Antoine B. Gregwell, President and CEO of DBGM Inc., a media organization that produces LGBTQ content. And we're happy to welcome Wardeh Hatab. He's a licensed clinical social worker and one of the conference speakers, and thank you so much for being here.
Thank you.
Okay. Mr. Gregwell, Antoine, if I may.
Thank you.
Can you, just tell us a little bit about how the very poignant clip that we just saw of the mother speaking, how does that relate to this conference?
Well, one of the things that we discovered when we were doing the film is that many black gay men have said that their relationship with their mothers was crucial to them accepting themselves for who they are. And the absence of that acceptance caused them to descend into or spiral down into depression and possibly suicidal ideation or attempts, as well as unhealthy behaviors, so like drug abuse, substance use, and that kind of stuff. But in the clip in the documentary, Wilhelmina Stone, the mother of a 14-year-old who committed suicide in 2003, talked about how, to her, he was just an ordinary kid. But the issue was that he was not accepted by his father for who he is, for who he was. And he was relentlessly bullied in school. He attended high school in Beltsville, Maryland. He was relentlessly bullied, and even though they protested and they asked questions, the school did nothing to help that. I wouldn't want to go into a lot more behind-the-scenes details surrounding Joshua's suicide, but to say that Joshua's suicide in 2003 is just the tip of a huge iceberg where we look at the mental health of LGBT people of color disproportionately because of racism, because of homophobia, because of stigma, because of discrimination. And these titles, these descriptives, are huge, and if you decide to unpack any one of them, we can be here all day.
Well, let's go. I want to bring you as the point of entry. You work as a clinician, and you're working with people. This was 2003. We're still seeing this effect happen all too often, and in some ways it's even amplified and multiplied by social media and all of the pressures that young people face now.
Right. My focus is primarily with Middle East, North African peoples and the LGBT community. And social media has a huge influence on movements and also with mental health issues. I think with the advent of online therapy most recently, it has become more accessible for people to get therapy when they feel that they can't go to their own geographic communities for fear of being seen by others or fear of being outed, because those are still very complex issues within the community that I'm specializing in. They've also used a lot of social media to come out of the digital closet as a proponent for activism in places such as Turkey. And I think also with a lot of the reactions to what happened in the Orlando shooting, a lot of the issues around Middle Eastern mental health issues and also with homophobia have also kind of come to the forefront of the discussions around these topics.
Well, clinically speaking, what are some of the, major issues that the community is facing?
One of the biggest issues that I've seen is, whether coming out as a milestone can be really difficult. A lot of Middle Eastern and North African families have really were able to survive influence of colonialism and imperialism by bonding together and being able to survive throughout the decades because of that. So, having a you know, being able to rely on your family and stay with your family can be very difficult when you when you want to come out, because you're not sure if your family will accept you, and issues related to marriage, career, that's all a collective decision with the family. That's just how it's worked. And so the concept of coming out can bring a lot of internal conflict.
So Antoine, that's nothing that's foreign just to Middle Eastern or North African communities. So how did you guys decide to frame this and come up with In Our Minds?
Well, the whole idea of In Our Minds was, if we're talking mental health, it's in your mind. And then the title of the conference took off from there. This year is a 2-day conference. Last year we had a 1-day conference that was generously hosted by Mount Sinai at the Union Square location. And after the end of the conference, at the end of the conference, we had over 100 people still remaining. And they were asking, they were saying, they were demanding that a 1-day conference is not enough. And I'm standing there at the side looking at them, and I'm like, are you guys out of your minds? And I'm like, I literally grabbed my head. I'm like, 2 days? But we're 2 days away from a 2-day conference.
People have spoken.
You know, and the thing about it is that now it's being held at the Alexander Hamilton U.S. Customs House building. We've got 5 breakout sessions with 5 breakouts in each session, so we got 25 sessions over 2 days. We're going to have lunchtime performances. We're having different speakers, including the public advocate, Letitia James, Wade Davis, the former NFL player, right? Warda is one of our presenters, and I was so excited to have her do a presentation, a workshop on that construct of mental health for LGBT people in North Africa. And as we were talking before the show, is that that's a further subset, because they're still people of color,
Right.
but they're a further subset within that.
You know, I have to add this. You know, in my mind, I was sort of really wondering where, you know, the title of the conference came from. So I wanted to speak to you about that. But in the wake of the shootings, the tragedy in Orlando a couple of months ago, you wrote an open letter and made a statement. And I just really found it really poignant. You said, "We are concerned too often that many in our communities recognize that our relatives and friends are struggling and suffering with a mental health issue. But our fear of discrimination, of being stigmatized, paralyzes us and prevents us from taking action to ensure our loved ones receive the help he or she needs and deserves before he or she does something as a final act of defiance against that which rages in his or her head."
Yes. When Orlando happened, I was incensed. Because, and I spoke about this at a conference in South Carolina shortly afterwards, is that there were several victims involved here. Not just the victims of the shooting at Pulse Club, but the shooter himself was a victim. Because it was known that he was known that he had homosexual relationships. But because of his religious belief systems, some of which were fundamentalist, some of which were oppressive, and some of which historically, there is no basis for homosexuality in the Quran, that he was fundamentally subjected to that belief system, which was somewhat radicalized, somewhat, you know, outside of the mainstream, and forced to conform, which is nonetheless different than some in our Black and Latino communities who belong to churches and religious institutions that demonize and tell their children, tell the parents that your son is an abomination, your son is a curse, because he or she might have a same-sex relationship. It doesn't take into account that the pastor may be having sex with some of the other people, with other church brothers or the wife. It doesn't. The hypocrisy is what becomes clear. And when a mother goes home, and then casts out her son or daughter because that son or daughter simply wants to be who he or she is, then that's a huge problem.
So I want to get on to the clinical end again, because in our lifetime, we've just seen homosexuality fall as a mental health disorder, according to some of the academy.
yeah.
So
DSM.
as we continue in that evolution, what is happening now in terms of working with people and recognizing that they're not deficient because of their sexual orientation? How is the medical community moving forward and helping to bring people into the tent?
Thankfully, I think just being able to be openly gay or lesbian has really helped a lot of clients connect with providers, because there is a very large LGBT community of providers who work in mental health. I think globally, and I can only speak for what I'm going to present at the conference, but there's a big movement in Lebanon to declassify being gay as a mental illness, because it's still seen as a mental health condition in some parts of the world. I still think we do have a lot of work to do, though, clinically. The DSM-5 still has gender identity disorder listed as an actual diagnosis.
Right.
So, a lot of trans women and men, are talking about how that still needs to be removed. And also, I think there's also a lot of discussions around substance use and trying to understand how that is like a coping mechanism for people who have been ostracized by their families or their communities after coming out, or even preparing them for what could happen if they do come out and they are stigmatized.
Who is this conference for? How are you reaching out to people in its last few days? How can we make sure that the people that need the help know that it's available? I think we're doing that now.
Yes.
But,
Every little bit helps,
it's,
Yes. I think there's been a great groundswell of interest in this conference. As somebody commented to me that this is the hot ticket in the city on Wednesday and Thursday. Everybody wants to be there. We've been pushing it on
make it
Facebook.
3 days.
I don't know. Let me just get through these 2 days, okay? Everybody who's been involved with the conference planning has been pushing it. And I'm glad that you asked that question, because there is two sides to this. And I thought about it the other day, and I was like, we don't have any funding for this conference. I've been begging everybody and badgering and pleading and, If we were to have corporate sponsorship for the overall conference, let's say they gave us $500,000 or whatever, we could have a fantastic conference. We could hire all sorts of people, but there may not be a community involvement. So what we are doing is that we have partnered and we've collaborated with a number of community-based organizations around the New York City area. And through those community-based organizations, they then distribute or disseminate information about the conference to their networks. Right. So there's more community buy-in. Though it's difficult, because a lot of them don't have any funding to help me even to buy an ad in the conference journal. Yeah. But it's sufficient.
And the need is so apparent as well. So collectively, we're stronger together. So tell people how they can still get involved, and if there's a potential donor, underwriter, corporate sponsor out there who wants to keep it in the community, how do they get in touch? What do they do?
They can go to dbgm.org, to the website, or they can send an email to info@dbgm.org. And that email will come directly to me. Because I don't want to kind of like give out my my DBGM email address on air, because then I get inundated.
We'll find you.
But I know. But the thing about it is that hopefully after this year's conference, we'll be able to have a conference next year. Identify a suitable space that can accommodate all of the workshops, all of the breakouts. There are some things that we're not able to talk about this year. We're not able to talk and address the mental health of LGBT who are incarcerated. We are not able to talk. There's one workshop on dealing with LGBT of color who are aging out of foster care. But we're not able to address mental health of LGBT young people who are in foster care, who've been first rejected by their parents in foster care, but then they are in foster care with some overly religious mother or father who don't like because they're gay or lesbian, and then they get kicked out again.
The issues keep coming, but we definitely will make everyone aware to get yourself out Wednesday, October 5th and Thursday the 6th to Bowling Green downtown at the Custom House. Yeah, it's right on the tip there. So
Recognizing,
make sure you come out.
articulating, and meeting our needs. So thank you
Yes.
so much.
Thank you very much.